Welcome everyone. This is to a great doc talk today. This doc talk today is healthy aging and avoiding frailty as you get older. It's a presentation of the primary care networks in Burnaby, and we're so lucky to have Dr. Grace Park with us. Dr. Park is the program medical director for home health at Fraser Health, and she's a practicing family physician. She provides care and support to clients living independently at home for as long as possible. She's actively involved with the divisions of family practice and the work of the Integrated Health Network, making significant progress in the home health integration with community family physicians. And she's also a clinical assistant professor with the Department of Family Practice at the University of British Columbia. Before I turn it over to Dr. Park, I do want to mention a couple of things. First of all, this session is being recorded, just so you're aware. And to that, the session will be available afterward to attendees and also to those that you'd like to refer to it on the www.burnabykoronavirus.com website. If you do have questions through the presentation, please use the Q&A box, which is the little Q&A right at the bottom of the Zoom, and put in your questions there. As time permits, we'll do our very best to answer those questions. But if we don't get, for some reason we don't get to some of those questions, we will also do our best to respond to you after the event and ensure that your questions or queries are answered at that time. And so without further ado, I'd like to turn it over to Dr. Park.
Hello, everyone. Thank you for joining us. It's a real pleasure to be here to talk to you about a project that I've been working on for the last 6 years or so. As Jeff said, I'm a family physician. I work in White Rock, South Surrey, but I've been with Fraser Health now for about 10 years. And this project I've been working on with preventing frailty has been a passion of mine for the last 5 or 6 years or so. So I'm really thrilled to be able to share some of this with you. So the good news is the life expectancy for our Canadians is increasing over time. And you can see on the bottom here, across the bottom are the years the people were born, and the life expectancy is in the vertical axis there in years. And since 1921, you can see the gradual increase in life expectancy. And this goes up to 2006, and it's gone up even a little bit more since then. So that's the good news. But the bad news is still we have a lot of our seniors spending the last 8 to 10 years of their lives living with frailty. So for aging or the number of age is one aspect, but the other part is, of course, how fit you are and how functional and active you are as you age. And you can see this graph also shows you that there is an annual mortality rate, the number of people that actually pass away over time, according to age groups along the bottom. But as you get older and older, there is quite a lot of variation in terms of the mortality rate. And so that speaks to the difference in how we age. And that's the heterogeneity that this graph talks about. So you can look like this fella on the left at age 80, or you can look like this fella on the right, who's running a marathon at age 85. So that's the beauty of frailty prevention work that we've been doing, is addressing that difference in how can we be more like the guy on the right. So frailty is a really important topic, and I know you've heard the term and people have been talking about frailty for a long time, but from our healthcare perspective, when you look at the three graphs here, at the top, people that are managing well, that are not frail, they respond to stresses like the flu or something happening to them, and they have a little blip in their function, so they kind of drop in their function, but then over time they recover. And then they're back to where they were at before the flu or the life-changing event, or maybe an elective surgery or something. But people with mild frailty even, they'll have a little blip and they'll drop down in their level of functioning, and they won't recover as quickly, and they might not recover quite back to where they were at. And you might feel that yourself, or you might have seen that in family members or friends, that something really took a lot out of them. It took them 3 months to recover from the flu, and they're not quite back to where they're at. So then for those that are really severely frail, the ones that actually are needing help to get by on their day-to-day activities, they have a negative event like the flu, and they are really severely debilitated by it. It takes them a long, long time to get back to where they are functioning a bit. and they may not even get back to being independent. So frailty is really an important topic, and we want to emphasize it because you can actually avoid yourself from getting into that severe frailty as you get older. And that is the exciting part of it. So frailty has been defined in the medical literature as a loss of reserve in your body in multiple systems that leads you to become vulnerable and lead to health decline. And then, of course, the inability to recover, as the last slide showed. And in the past, we used to measure frailty mostly in physical terms. So slow gait, you just can't walk as well as you used to. Weight loss unintentionally, mostly muscle mass weight loss. Weakness, you have difficulty opening jars, you can't walk up the stairs without getting fatigued. Low physical activity, you just can't get out and do the things that you used to. Easily exhausted, you get tired with minimal things. But lately, we've been working with a different definition of frailty that's a little bit more clearer and a little bit more sensitive. And it's called health deficit accumulation, which means you have things go wrong with you as you age, and we all know that. And every year, you actually have 4.5% more things going wrong with you. And so if you had 5 things wrong with you at age 65, you might have a little bit more by age 66. And in 15 years, you actually double the number of things wrong with you. So if you think about age between 60 and 75, things go wrong with you, and you can double by the time you're age 75, and certainly between 75 and 90, that's the last part of your life perhaps where you double the things going wrong with you. And when you know what's going wrong with you, you can actually intervene and fix them. And that's how we prevent further decline in health and frailty. So in primary care, and this is a group of physicians that I work with in Burnaby, as well as other communities in Fraser Health and the rest of the province actually, the physicians can actually talk to you about what might make you frail and how can we intervene so that you don't progress on. So as their population ages and as your GPs see you over the years, they can see that you may be entering that early at-risk phase or pre-frail stage, and then look at things that are going wrong with you and intervene, and so that we can actually prevent you from progressing in frailty. And so aging does not equal frailty is the message. So the years that you have lived does not mean that you are going to be frail, and it's unnecessary for you to be frail. You can actually look like her, and you just have to work hard at it, and there are ways to do that. So now we do have ways of measuring frailty. And when you talk about this with your GPs, they are very familiar with this tool, which was published by Dr. Ken Rockwood from Dalhousie in Halifax. And this is where you have a number to identify you. And with number 1 to 3, you're quite fit and you're independent. With number 1, you're actually exercising and you're really robust. By number 3, you're starting to maybe gather some chronic diseases, maybe like hypertension and diabetes. But by 4, you're starting to become more vulnerable. And so with early frailty, it might be that you need a walking aid. You might need some help getting up the stairs. You're just feeling a bit slowed up. But by the time you get to a scale of 5 and 6, you need help with things. So by 5, you need help with things that are outside the home, like banking, shopping, picking up medication, transportation. And by 6, that's when we need help with personal care, with things inside the home, like you might need help with showering and bathing. And so we don't want to go there, but that's the population that often lands up in our hospital, and often the people that we have to help from Fraser Health, sending people in to help them in the home. So that's where we want to avoid that. And of course, when you get more severely frail, these are people that are approaching very late years in their lives and even end of life. So when we talk about frailty, it's not just the physical aspect that we talked about earlier. We're looking at a holistic approach, which is a biopsychosocial model. So when you talk to your doctor about yourself and your health and healthy aging, you can talk about the biology. So this is a tool that is available for physicians. So your GPs can actually fill out this tool that addresses your biology. That's your memory or cognition, your physical function, how your balance is, how your strength is, etc., and your general health, like your medications and that kind of thing. So that would fall under biology. Under psychology would be your mental health, your mood. Are you depressed? Are you anxious? Do you suffer from hallucinations, delirium? Those are sorts of questions that your GP can ask you. And then under psychology, you can talk about what matters to you, what are important in your life, what goals would be important. Do you need to be active so that you can be with your grandchildren? Do you want to stay in your home as long as possible? What sorts of caregiving supports are there, etc.? So that will be the psychology contributing to your mental health. And then there is a social life, and that's a series of questions that your doctor can ask you about your family, your friends, who actually helps you if you need some help with things like banking and finances, who actually is your caregiver. If you're more progressed and you need some help in the home, who is helping you with that? Is it a family member, or is it somebody that you hire, or is it a public system like with Fraser Health? And then in your community, do you have connections in the community that help you with things like your finances, your housing? All of those things make up your social health. And so when you combine all these questions on this form, it gives you that fulsome picture of your biology, your psychology, and your sociology. And so that's what we call the comprehensive geriatric assessment. And the GPs in Burnaby and elsewhere now have access to this tool, and we're spreading this as part of what we call the CARES project. So CARES is the acronym for Community Actions and Resources Empowering Seniors, and you might hear more about that in your community. So doing the comprehensive geriatric assessment leads to a care plan. And the care plan is where you actually go through all of those things that might surface when your doctor talks to you about things in your life, whether they're biological, psychological, or in your social life. So the care plan will inquire about your medical issues, your goals of care, what you wish to have happen if you are getting older in life and projecting down to when you're becoming more dependent. What are your goals at that point in time? A medication review to ensure that you're on absolutely the minimum number of medications and doses, and whether there's any interactions with your medications. And then there is an opportunity to reassess your care plan on a yearly basis. So you can actually talk to your doctor about, I want to talk about my healthy aging and my plan for frailty prevention. And then along with that, there is a component called the wellness plan. So just as I talked about things going wrong with you, the health deficits, there are health protective things that we know will improve your health, support your healthy aging plan, and reduce your likelihood of becoming frail. And those are things that address your diet to ensure that you have a healthy diet, socialization, improved exercise, exercise in your life, as well as caregiver support for those that help you as you get older. So that's your wellness plan. And then the last portion that we've added recently is the social prescribing. And the social prescribing is available to your GPs as well, where they can actually write a prescription to a community organization. And then in Burnaby, it's Mosaic. And in every community in Fraser Health, we have a community organization that will receive referrals from their GPs with a social prescription. And the social prescription is what provides that supports that wellness plan. So the healthy diet, the socialization, exercise, caregiver support. Under diet, we also include food security, because we know that people that have financial concerns are not able to get out to ensure they eat a healthy diet. That sort of thing can also be supported through social prescribing. Socialization, we know that there are a lot of reasons why maybe seniors are not getting out to see their friends. And right now, of course, is COVID and social distancing. But even before COVID, we knew there were a lot of seniors that hardly ever go out. They lack the ability to go out, maybe physically or financially, they won't engage in things because they're limited that way. Psychologically, they don't have the confidence to get out and join exercise groups or social groups, etc. So those are things that social prescribing can address. And exercise, and I'll talk about that later. And caregiver support, especially for patients that have a bit of dementia or more progressed dementia. They might rely on only their spouse or their adult children to provide support for them in their home. And maybe they decline home health help from Fraser Health or other health authorities. And so the caregivers are having to carry a lot of responsibility, and they do get burnt out. So they need the support as well. And so those are some of the health protective factors that social prescribing will address. And so our CARES project has partnered with United Way, and they have working with the community-based senior services organizations. Again, Mosaic in Burnaby, they have a whole list of services that can contribute to ensuring that those health protective factors are supported in the community. And we've actually ensured that each community has one single point of entry, so your GP can send a referral to this one person, and they get to know them over time, and we call that person a seniors community connector. So the idea of social prescribing comes to us from United Kingdom, Scotland. They've done a lot of work to address loneliness and a lot of work to address issues that are not medical, but will contribute to the health of a senior as they get older. So on the left, we have a healthcare professional addressing, the issues that come into the office, and then they recognize that maybe there's a need for a link worker, they're called, or in our community, the seniors community connector, to speak with the patient and their family about issues that are social, so non-medical, but contributing to their health. And so then the link worker, our connector, will speak with the patient. When they receive the referral, they'll connect with the senior and their family and have a fulsome conversation about what sorts of things they might be interested in doing to promote their health. So addressing their food security, their socialization, the exercise, the caregivers, those things that we know are going to contribute to their health as they age. The link worker then will connect them to all of those resources in the community that they have available. And they will look at barriers. So if it's a transportation barrier, then they'll look at what volunteer driving services might be available. Or if it's a psychological barrier, they'll provide the support and counseling that might be necessary to move them a little bit further toward being able to get out to connect to their community resources, which we know is really necessary for their health. So we know that community resources exist, and this is in my community. There's lots of activity. There's an intergenerational kitchen there in the picture on the left. Lots of excursions, bus trips to Vancouver for concerts, etc. And so these things are in the community, but many seniors do not know about them or do not have the support to get out there and join. And that's what the social prescribing can do, is actually take them by the hand, show them the activities, and if that's what they would like to try, just try and get rid of barriers so that they can actually engage. So I want to talk about social isolation because it's really an important topic. We don't really recognize it a lot, and so social prescription is a way of addressing this. But as family physicians, we are able to pick up risk factors for social isolation. So people living alone, we know they're at risk because they might choose to just not go out. Transitions in life, if there's a loss of partner, if a spouse has recently died, that's a real red flag for us, because we have so often seen, the remaining spouse really decline in health in a matter of months to a year after the loss of their partner. So that's the time that we really need to be very, very careful and intervene. Loss of jobs, limited access to transportation, financial limitations, those are again, situations that lead to more social isolation. In a rural setting, if you're by yourself and maybe you don't have any family members or adult children, they're no longer near you because they've moved away, that also is a huge risk factor. So community restrictions because you're in a very rural, isolated setting is a huge risk as well. Immigrant population with English as a second language, they need a lot of support that's culture and age appropriate. And of course, our minority groups, we also need to pay attention to. And so the health risk factors are there with these social risk factors. And so your GPs are going to pick up on this in your everyday conversations. When you go to see your GP, you can let them know about what's happening in your life, and they'll be able to intervene as they see some of these risk factors happening. And with social isolation, we know from research that it's almost as bad as smoking 15 cigarettes per day to have social isolation. It increases your chance of premature death, increases your chance for mental health concerns like depression and anxiety, increases your likelihood of progressing in dementia and loss of mental function, reduced quality of life for sure, caregiver burden if you have adult children that are looking after you or helping you in your life. If you're isolated, that's more of a burden for your family, and general health decline, and also increased number of falls, which we know is hugely detrimental for the well-being of our senior, because falls often lead to fractures, and fractures can lead to a limited life. So all of these things are health risks of social isolation, and that's why it's so important for us to address social health as part of our frailty prevention and healthy aging. So the good news is, though, there are lots of things you can do to improve your socialization. Anything that you would find interesting that could be fun. And in the UK, they really promote these garden clubs because there's such inherent value in being outdoors with other people with common interests and getting in the soil and watching new life form and grow. That's been really helpful for our seniors to remain healthy. But it could also be conversation circles, cooking classes, book clubs, anything where you can connect with people with like interests. So that's a real thing that we need to promote. And then we also know that men are more reluctant than women to join in activities. So this is from Australia. They've developed a thing called Men's Shed, and this is becoming recognized all over the world, that men actually maybe need a different way of connecting with other men to increase socialization. And it doesn't have to be anything formal. Doesn't have to be in a community center, even it can be in somebody's garage, just sharing a common interest. If you have interest in woodworking or interest in motorcycles, and so the Hells Angels, they have quite a following. Not that we want to be part of them, but you might be interested in bicycles, and you can form a little community gathering of like-minded seniors, like-minded friends, and getting together for coffee and improving your socialization that way. So when you address frailty with your family doctor, now you can talk about wanting to intervene because I don't want to be frail when I get to be 90. What can I do now when I'm 70, when I'm 65? What is my frailty index? And your GP may not be yet using frailty index as part of the measure of frailty, but it is coming because we have education coming to GPs all the time through Doctors of BC, from BC Guidelines of Care, and the work that we've been doing out to GPs to talk to them about the frailty index. So that's something that you can talk about with them. And then the opportunity for intervention, because as you get older, as I said, you start collecting things that are wrong with you. So how can we intervene so that we get rid of those things that are wrong with us? So if our balance is not so great, what can we do to improve our balance so that doesn't accumulate and become another thing that's wrong with you down the road? So that's reversing components of frailty and identifying the health deficits. And actually, you can reverse your frailty index. And we have done a study with 50 seniors, and we supported them to do exercise with peer coaching, telephone coaches that would talk to them about setting goals about exercise, what they're willing to do on a weekly basis. And we followed them for 6 months, and we actually reduced their frailty index score. And so we know that it helps to be able to support seniors to overcome whatever barriers and challenges they may have in getting out to doing those health protective things. And then, of course, developing a care plan with your family doctor is how you address your health concerns. And now you know about a wellness plan as well that you can talk to your doctor about. So Canadian Frailty Network is a body that's federally funded, and they have a lot of resources and research going on across the country and internationally about frailty. And they've recently sent out and doing this public health promotion about avoiding frailty, and it follows the short acronym AVOID. So for A is activity, not just for the fit people that are already exercising, disregard the pictures of the fit seniors, lifting weights. It can be for anybody. At any point of fitness or non-fitness or mobility, you can actually exercise. So even those are in walking with walkers, sitting in wheelchairs, there are exercise classes at Park and Rec, at the senior centers, etc. And you need to get your heart beating and listen a little bit with perspiration. And if you need some motivation, you can get some coaching. And BC Self-Management, if you just look them up, they will have a local number where you can call and get telephone coaching, as I spoke about earlier. And the telephone coach helps to set a little goal for you and say, okay, what can you do? Is it walking a block this week? Let's try and do that. And that's your goal. And she will help you, or he will help you to reach that goal on a weekly basis and follow you along over time until it becomes a matter of life and you're not needing the coaching anymore. So that's A. And V is for vaccination. And this is really important. We talk about vaccination with kids, of course, with the routine vaccinations since they're babies, with hepatitis and their pertussis, etc. But for seniors, it's really important that you get your vaccine, because this is how you're going to avoid those diseases, because each of those diseases will take you down and it won't be pretty. So we know with seniors, you have a change in your immune system, your ability to fight infection becomes reduced. And so the vaccination is what's going to help you. So your yearly flu shot, and we know your GPs will ensure that you get the high dose flu shot if you're in your senior years, the pneumonia vaccine, the shingles vaccine, hepatitis. And then if you're traveling in particular, we want to make sure that you have the booster shots for diphtheria and pertussis, polio, etc. And those things you can talk to your GP about, are you up to date with your vaccinations? And the flu shot season is a really great time to talk about your vaccinations, because that's when we think about the pneumonia vaccine as well. And then you may as well start thinking about your shingles and others things as also. And then the O is for optimized medication. And we know that as seniors age, and you probably know this with yourself perhaps, the number of pills start adding up when you start adding the vitamins that you're taking along with the prescription meds that your doctor's prescribed. You need to look at those pills every once in a while with your doctor and say, do I still need all of these? Because as you get older, some of these medications may not really be required. We have people, in sort of late 80s coming into residential care facilities because they're needing full-time kind of nursing care. They're on more than 10 medications, and we can actually really work hard to reduce them. But you can do that as you get older with your GP. Just say, I'm on these number of pills. What can we reduce? Is it possible to reduce? And then I in avoid is interaction, and that's the socialization. And I spent some time talking about the social isolation leading to poor health. And so we know the risk factors, life transitions, death of a spouse in particular. If you have a small social network, think of ways of increasing that social network. If you need some help, then the social prescribing can be really helpful, and you can talk to your GP about that. And we know that it really, really improves your mental health, which is a huge contributor to your overall health as you age. And then D is for diet and nutrition and food security. So remember that as you get older, food is medicine. So increased protein in your diet is really helpful as you get older. And then for thinning of the bone, osteoporosis, we want to make sure that you get some calcium and vitamin D. Vitamin D as a supplement for sure, because we don't get enough sunshine and we don't get vitamin D as you do in more sunny climates. Calcium you can get from your diet, but if you don't drink a lot of milk in your diet, you might need calcium supplementation as well, and you can talk to your doctor about that. And food security, again, if you have issues with food security because of your financial situation, when you need to talk to your doctor, they can refer you for the social prescribing, which will be really helpful. If you have difficulties with swallowing, with your digestion, all of that needs to be addressed because malabsorption is an issue as you get older. Digestion is an issue that could lead to poor nutrition, and we know that can be really detrimental to your health. So that's the avoid strategy from the Canadian Frailty Network. So if you could just remember those letters and then just talk about them with your doctor, they will make sure that you get everything you need to be able to, optimize everything that healthy aging can bring you. And remember that exercising helps everyone, and you can exercise at any age, at any state of function or mobility. And even with, some frailty, even if you have frailty, we can have you performing exercises that will reduce your frailty over time. And groups is definitely what we aim for, because with group activity, group exercise, you get that socializing as well as your exercise. And we have lots of people that get to know other members in an exercise group and will join for coffee or at least have conversations over time, which is really helpful. And with nutrition, remember that as you get older, you need more protein in your diet. There is a natural phenomenon called sarcopenia, and that's loss of muscle mass as you get older. And it helps if you start with a bigger muscle mass. So even before you get to your senior years, if you can build bigger muscles, that's great. But as you get older, you actually lose that muscle tissue and it gets replaced with connective tissue. And so you lose the muscle and you lose the weight, you lose the strength, you lose the balance. So sarcopenia is a real a frailty kind of marker. And so protein in your diet is really helpful. And also to try and carry a little bit extra weight so that you're on the upper end of your healthy weight range, because we know that that's protective. So we don't want to be too lean as we get older. So towards the end here, so just make sure that you become part of your community in order to age healthily. So in your community, you have your doctor, yes, you have your hospital, yes, but you really have your rec center, you have your community organizations, you have Mosaic, you have all those resources in your community that's going to help you to stay healthy. And you're going to talk to your doctors about what's going to make a difference for you as you get older so that you stay socially healthy and connected. And so frailty prevention is within your power, is something that we all need to work toward. And it's a walk in the park with your friends, with anybody that you like spending time with, and staying active is the answer. So I'm going to stop there and thank you so much. And these are some of the resources that I think you'll find helpful. If you connect with BC Self-Management, on their website, you can get that telephone coach. Canadian Frailty Network website has lots of resources for Canadians for healthy aging. Our CARES project, we have some documents if you Google Fraser Health CARES. And how to age well, if you Google that, there's lots of on web information to support things that I've said and other things that people are doing around the world. So I'd be happy to answer questions.
That's great. Thanks, Dr. Park. That was a wonderful presentation and lots of things for everybody to think about. I do have a question about just in terms of when should we, and I look at where I am in my life, when should I start to think about how I can stop, I can stop frailty from creeping in? Is there a place that's too early or a place that's the perfect place?
It's never too early. And I spoke about health deficits doubling every 15 years. So between the age of 35 and 50, you double the number of things wrong. And between 50 and 65, 65 and 70, etc. So as you get older, at any point in time, you should be thinking about this. But I think as people are towards their mid-50s, approaching 60 is a time that you should really be doubling down and saying, okay, what am I going to do? It's actually training for your senior years. And so if you think of it that way, sort of 50s would be a really great time to start the activities, and it's establishing a lifestyle. So a lifestyle that's socially active, getting into hobbies and activities that increase your socialization, and then ensuring that you're watching the number of pills that you take, talking to your doctor, going for regular health checks. So all of those things. So it's never too early, Jeff, and I'd get going if I were you.
Fortunately, I've already taken that advice. Thank you. but it's and I think what you're saying is particularly is it's going to be easier to maintain than it is to change. And kind of going to that, you talked about reversing frailty. Is that are there methods around reversing frailty or cautions around reversing frailty? I think that sometimes from my own personal experience, I see seniors who get frustrated and they want to change and they maybe go push a little too hard and it's detrimental. Is that something we have to?
Yes, and I think that's where you really do need to have somebody to talk to, and your family doctor is probably the best place to start and say, okay, I've had it with this, being a couch potato. I'm just going to go out and run a marathon. Well, that's not really wise. So talking about where you're at with your doctor is really important. If you have health concerns that would prevent you from suddenly going out and raising your blood pressure and your heart rate, you need to talk to your doctor about that. So I think the caution side is where you talk to your healthcare professional. But at any point, if you do enter a senior center-based exercise program, the person running the program is very cognizant of what is safe for people and will do some screening as well. And so if you have recently been, say, suffered with COVID and was in hospital and now you have to use a walker, you can go into a program and let them know where you're at and say, I used to be a runner, but now I have to walk with a walker because I was in ICU with COVID and I've lost all this exercise capacity. They will design a program that's safe for you. And that is something to keep in mind.
Yeah, and I think that it brings to that next point that I think is really critical to talk about. I know that and I just want to mention, in Burnaby, we're so lucky that we have so many great resources, both through the Parks and Recreation and through all of the different agencies, and that do supply those kind of programs. But in COVID, all of a sudden the door is closed. When I look at that avoid acronym and I look at it and I go, everything in that acronym, everything in avoid is challenged by COVID, isn't it? Are we seeing an increase in frailty because of COVID, or is it too early to tell?
I think it's too early to tell, but we have been working with United Way to evaluate our programs. And so we're looking at the number of people that are joining the social prescribing scheme and the rate at which we're getting new referrals. So we know that all of that has been slowed because of COVID. And then also the programming. My mother lives in Burnaby and she's been connected with Mosaic for the last couple of years. But just as she was going with her conversation circle for immigrants and her cooking classes for multicultural groups, the program shut down because of COVID. But it took a long time, but now they're kind of available through Zoom. So those that are able to use technology can join and use some of those online services now. So that's coming back. But I think over time, we will see that those that were isolated to start with have gotten more isolated during COVID, and we will see an increase in their frailty. And, if we were to have measured all of them right at the beginning and measure them a year later, we will see a decline in their function and their frailty scores.
Yeah, I think that it's interesting in Burnaby. We were fortunate. We've had some working groups that have been working around some of these issues since the start of COVID. So we've really tried to. You talk about technology, just so folks are aware. If people are having difficulty getting on technology or even need technology, there is support available in Burnaby through the multiple agencies. And you can get this information through the BurnabyCoronavirus.com website. But there's also a social isolation working group that is really focusing on how to support people. And so again, there's information that way. But I do want to go to, the social isolation piece. It is a critical piece, and it does seem as if COVID has really impacted folks in a fairly significant way. Is there advice you can give to even just within their own bubble as to how they can sort of, I think you mentioned people, when they start to become isolated, the natural tendency is to become more isolated, is to focus more inward. Is there advice you can give to folks as to how they might overcome that at all?
Well, I think, getting outdoors is something that we are still able to do. And so if you can get outdoors and walk with people in your bubble, certainly. And if you're socially able to socially distance, you can get together with your friends, in a safe manner. So that would be one way to go. But even with telephone calls, reaching out to each other, I think is hugely helpful. So with social prescribing, we do have agencies that now phone seniors that have been part of their program before and stay connected that way, but it's not perfect. So I think doing what you can on your own to ensure that you stay connected with your friends that you used to see regularly, I think is going to be helpful. And we do have light at the end of the tunnel. We will be vaccinating everybody. All our healthcare professionals are almost all been vaccinated. So next is the community residents, and we're, just maybe days away from starting that process. So our seniors will be able to get the vaccination and then start living a normal life again.
Yeah, and I know that's the questions we're getting in our seniors working group quite a bit about how will the vaccine roll out? How will they find me? When is my turn? But all that information is coming forward. We know that. I do want to mention
days
that.
Away.
Yeah, days away. That's good to hear. The Primary Care Network has also launched a Say Hello campaign that we really think that is supportive of everybody's social isolation, but also for seniors. Just so the willingness to just say hello to people that you don't know, just to have that little bit of connection seems to be very valuable for people. So
that's great.
we're always looking at promoting that. That's for certain. But again, you talked about one of the gaps that we've really seen is around exercise, and I think you mentioned getting outside, because we know in Burnaby we had these great activity programs, at the rec centers where people would come together, and it was their, the seniors in fitness classes were some of the biggest classes, and that was their social connection as well as their physical connection, and they've lost both. But are there things they can do in the meantime just to stay physically active?
Well, walking outdoors, that is sort of mostly available to people that's to be able to walk outdoors. And, if you can find a running track, there's one in North Burnaby that I go to with my mom and walk with her. And we see people walking with walkers in wheelchairs or walking with canes. Whatever you're able to do, just get out and walk. If you can't get out, then walking even just on your sidewalk back and forth with help if your sidewalk seems safe. All of those things I think is helpful. The recreational classes were so great, and we're very close to having them open again. So do what you can to remain active. If you have ability to use an indoor bicycle or, a stationary exercise equipment or whatever, you can do that. Again, better to have it supervised. So if you've got somebody to be with you as you're doing that, that's great, just to maintain your activity. You need to use those muscles or they will shrink away faster than,
Yeah, and then sitting, for instance.
Sitting is not good.
Not good. Yeah. And one of the things you keyed on was really being able to connect with your family doctor through this process. And I guess that's, again, I'm sorry to focus on it, but it is where we are at right now, is that at the time of COVID, it's become harder. Seniors have they're rightly sort of stayed away from face-to-face contact. And although they have connection with their doctor through the phone, it doesn't seem like it's quite the same. Is there advice you can give to folks who are connecting with their doctor as to the best way they can do that, either over the phone or via Zoom, or hints that they can use?
If it's possible to do it by video, that is better, because there's, so much more information your doctor can gain by seeing your face, seeing your expression, seeing your surrounding, etc. So the video is the best way to go, but if not, then the telephone connection is okay. But with telephone connection, you can actually ask for a sort of a yearly physical, but just a telephone component of it. So can you go through my chart and do a yearly check with me, because I don't know when you're going to be doing physical exams again. So you might need to go through, have you had all your medications updated? Have you had all your screening tests done? When was your last mammogram? When was your last colonoscopy? Do you need a follow-up because of some doctor that you saw that was a specialist? Do you need to have a repeat visit with them? So go through all of those things on the telephone, and that's something that your GP can do anytime, because we're not doing a yearly physical. You can actually do a component of your comprehensive geriatric assessment by telephone. And that's what we do now, because we can't do face-to-face exams. We're actually doing those frailty assessments by telephone.
Yeah, and I guess it's also, when it's face to face, it's much easier to have that conversation about, this is what's going on with me. You were talking about that, and I guess would it be important for folks to be able to kind of remember to write down the things they want to be able to share, as you say,
Of course.
which is not just health. It's just, this is what's going on in my life. So would that be important for seniors and folk and potential?
Yeah. Well, if you can write down avoid and look at all the things that you need to think about, and then talk to your doctor about avoid and say, okay, doc, when was my last vaccination for Shingrix, and am I caught up to date? And how many pills, do I really need to take at my age? And is it still helping me to be on my cholesterol lowering pill at my age? That kind of questioning is really important. So having things to talk about, on the telephone, I think is really helpful, because sometimes you can forget, or you can get carried away with one topic and forget about the last thing that you needed to talk about. So have those, helpful reminders. And your doctor might be limited in time, but when you say, I want to do a sort of a yearly physical on the telephone, they will allot a little more time for you to do that.
Yeah, that's great. And I do want to talk about a couple of the pieces in the avoid spectrum. One in particular, I did want to mention that through the PC and the Food Network has the opportunity to deliver food to anyone who needs it in Burnaby. For seniors in particular, those could be prepared meals, or those could be groceries. If you have the financial means, then it can be delivered, and you can pay for it. If you don't have the financial means, that isn't a deterrent, because there's ample food resource out there. So please make sure that you're getting the food you need and the diet you need, and the food that's being distributed is of very high quality. There's Ken Kuhn has a question around the high dose influenza vaccine recommendation from NACI for 65 plus. Could you talk about that a little bit, particularly for those with pre-existing?
Sure. So the flu vaccine every year, we've been watching the response that the seniors have to the vaccination, whether they actually get the right kind of antibody response so that you become immune to influenza. But as a senior's age, your immune system actually is less effective. And so they do need a bigger challenge to the immune system to develop that appropriate response to be resistant to the flu. So that's why the seniors are offered the high dose vaccine.
Right. And that's something that all seniors should think about getting.
Yes, and the GPs are very aware of that. And so mostly your GPs will be offering that to you if you're in the seniors age group. But if you are, and also pharmacies, they'll ask you your age and give you the appropriate vaccine, but that's just something for you to know.
And I think that's the other thing is seniors aren't getting out to their pharmacies as much as they used to. It's one less thing these days too. So it's
it's being delivered mostly, hopefully being delivered.
Yeah. That's a question around the SMART test. Is that test still being used as a memory assessment tool?
The SMART, I'm not as familiar with, but it is being used, I think, for driver's medicals. So the tool for memory is called the MOCA, M-O-C-A. And we also have one called the Mini Cognitive Assessment Test, and that's a 3-word recall, and your ability to draw a face of a clock with the arms and the numbers on the clock, and a time of, a certain time on the clock. So that's a test that the doctors do as a screen to see whether you're starting to have issues with your cognition, your mental abilities, or development of early dementia. So that's those. So the mini-cog and the MOCA are the two familiar tests that we have as part of our CARES project, our geriatric assessment. And the SIMART is more geared toward the driver's medical, and you can ask your GP about that if they use that.
Great, thank you. I think that there's always folks who come on these calls who are coming on with the thought around not necessarily themselves, although like me, they probably should be, but about their families. And I think there's always, we hear it, you know, it's great to have the knowledge, but how do we gently convince? What can we use as the drivers to help our family members sort of take these steps? Is there anything you can talk to those care providers?
Yeah, it's really difficult as caregivers. Sometimes you are really tired saying the same thing over and over again and not having it listened to. And that's where you need to actually talk to a support group for yourself as a caregiver. And so you can talk to Mosaic in Burnaby, or Social Prescribing will have caregivers support. And Family Caregivers of BC is another website that you can go to, and they have people all over BC that can support caregivers. And they have education and counseling services for people that are caregivers on how to deal with some of these difficult issues. And, you know, it's great for you to have the knowledge to be able to gently persuade your loved one to go down that route. But if it's getting to be a battle for you to, you know, do one thing, it'd be really hard to get them to do this other thing. That's where you need the support of the greater organization. And the Family Caregivers of BC is a really great resource, as well as your local community resources.
Yeah, and there are some great local. I know Linda Siggers is on the call today from our local community organization, which is a really strong organization that people can access if they're interested. I guess you go to that point. It's you know, I mean, how much, and you mentioned it in your presentation, how much impact is there on the caregiver themselves, and how much is acting as a caregiver contributing to their potential frailty? I guess that's always a challenge.
Yes, for sure. Being a caregiver is one of those socially isolating risk factors. Yeah. And so you spend so much time being a caregiver that you start neglecting your own health. And this we see in particular, say, partners of people living with dementia in the community. They have to be there 24/7 and often don't even have the time to reach out for help. So that's where you have to really try and make some time to get the supports for yourself so that you can carry on.
Yeah. Yeah. I did want to mention, just for folks, so folks are aware, again, through the PCN working group, the seniors working group, there will be a seniors activity fair online coming on in April, which will really focus on all of the different programs that are available for seniors in the community. So it'll be late March or early April, and it will really, as I say, create some opportunity for connection. Also, as new programs are coming online, there's an opportunity there, and there'll be some fun things to do, like some cooking and some learning to some different things as well. So you'll see some more information. Folks will see some more information about that.
And sorry, Jeff, one more thing. It's really great to know about these resources, but remember the people that need the extra support to be able to motivate them and to reduce the barriers. And that's where the social prescribing comes in, because there is a person that will actually talk to you about them, figure out where the barriers are, the psychological barriers in particular. So even if you know about these things, you won't go to them. And so that's where the social prescribing is so helpful. So talk to your GP about that.
Absolutely. Absolutely. Well, we're just about at time. There was one question that I think someone was asking about finding a family doctor, and I will point them to the PCN website, because we do have mechanisms in Burnaby, but the real question was how to find one as wonderful as Dr. Park. And I'm not sure if you can. I'm pretty certain you're not taking patients, but I'm not sure.
Well, I know many wonderful family doctors in Burnaby, and so it's a matter of just looking and finding the right one for you and building that relationship. And seeing your doctor when you're well is also really important because they get to know what your baseline is. And so when you're talking about frailty, they need to know when you're functioning well, so that when something happens and it's taking you a long time to recover, they'll start thinking, well, there is a bit of frailty here. They're taking way longer than they need to recover from this condition. So stay in touch, call often, get to know your doctor well.
I think that's a great place to leave it. Well, thank you so much, Dr. Park. I know that this was valuable for me, and I'm sure it was valuable for everybody on the call.
It was my pleasure.
I do want to remind people that there will be this session will be available, and I think it will be emailed out to all attendees, but it will also be on the BurnabyCoronavirus.com website. And there are other doc talks on there as well that you may find interesting. There are doc talks around the vaccine and other pieces, which are obviously incredibly important. There will be more forthcoming, and there's also many of the resources, almost all of the resources that we talked about today are available on that website, as well as through your family doctor and through the many agencies who are involved in the work in Burnaby, including the Mosaic and the CARES program. So again, I just want to thank Dr. Park and thank everybody for coming, and enjoy such a beautiful day in Burnaby.
Thank you, Jeff, and thanks to everybody at the Burnaby Division, and to all the audience members, and happy, healthy aging to you all.
Great. Thanks, then.